So, in this professionalism in anesthesia practice, see, the great professionals inspire a team, great professionals. So, they help their organization if they are a good professionals. And now there is a high class demand for the professionals, that who are the leaders. If your leadership is combined with the professionalism, your expectations of you from the society will be more. So now I asked Dr. Srijit and Dr. Shamshad Madam, what exactly you want to listen from me as professionalism in anesthesia practice. They have mailed me, they want to know how to become a good anesthesiologist, interpersonal relationship, interdepartmental relationship, behavior towards residents, approach to technicians, and a departmental hierarchy. But I want to add personal discipline, integrity, and empathy is also part of professionalism. So, how to be a good anesthesiologist? See, it is challenging the status quo. You have to come out of your department to make things work. That is the first quality of a professional. And we have to teach the fundamental components blended with advanced developments. That is a key quality of great leaders. And we have to accept the things which we can change and which we cannot. And we have to change the direction accordingly to be a good professional. So then we have to create opportunity for others. So if you are a good professional, your self-esteem increases and patients also be benefited from the positive attitude of the professional. So we have to accept the changes occurring in healthcare sector. Now, first point, how to be a good professional. Now the field of anesthesia has expanded, not only confined to the operating rooms. So anesthesiologists are catering to many facilities outside the operating room. So if you want to be a good professional, please try to cater outside the operating room also. So how to cater outside the operating room? It is all these parameters. So we should redefine ourselves as a perioperative physician, that is mandatory. We can step into pain clinic, we can step into education, we can step into research, then ICU, CPCR training. So many areas are there to be a good professional. So don't confine yourself within the four walls of operation theater. I have to rush because he has given so many topics. Then interpersonal relationship. In the interpersonal relationship, the first thing we require as a good professional is only communication. So I was a dean for 7 years and in the cadre of DME for 3 years. In all these 10 years, I have seen the best chiefs who got into difficulties with their staff or in the dean's office. They displayed an inability to communicate well, but they are good doctors. They are good doctors, but they are not good professionals. If you are a good professional, in addition to your clinical skill, you should know how to exhibit your feelings. So I used to say, whenever you are talking to an administrator who can do things for you, you think for 2 hours just to present it within 2 minutes. So you rehearse for 2 hours, present it in 2 minutes. Then, if you ask your subordinate to communicate to your superiors, what will happen? See, instead of Foley's catheter, one person has written as Foley's catheter. Then another one, ultrasound abdomen, AP lateral. So these things will happen if you are asking your subordinate to communicate. So you have to communicate. And see, even if you communicate, be careful as a professional, even a clear communication can convey a different meaning at some times, but the communication will be clear. Don't get confused. I will give you the example. See, now buy 3, get 1 free is for clothing. But see, just because these people have taken a photograph there, it looks as if we buy 3, we will get 1 free. So even a clear-cut communication can convey a different meaning. So in a doctor-patient interpersonal relationship, so many people will be changing at the other end, but we will be the only one here. So in a doctor-patient relationship, documentation is important, communication is important, then documentation of the communication is important, then communication of the documentation is important, preservation of the documentation is important. So as a professional, we have to have these 5 things in a doctor-patient relationship. Then, to avoid litigation, never be angry with the patient. Don't charge too much as a bank robber. Don't insist on fees if you expect a problem. Explain everything without any bias. Have a proper documentation again. This is an interpersonal relationship with the patient. Now, professionalism with anesthesia residents. See, I pity the anesthesia residents for one reason. One, we say beaten iron becomes the steel, and tortured students become doctors. The most tortured become anesthesia residents because they are working without a break. I have seen them working. So most tortured people will become anesthesia residents. Worse still, they don't have the time to teach CRRI and the students. That is a glamour of medical profession. Professional, as a professional, we want to teach. See, they may be handsome as Salman Khan or beautiful as Aishwarya Rai, but they will be always wearing a mask with that worst theatre dress, blue or green. They cannot wear jeans, they cannot wear whatever they like. So this is a stress on the part of the anesthesia residents. So they have to be dealt with accordingly. So the attitude, you please tell them what to pursue and what not to. A teacher must acquire skills without fear or favor. But nowadays, what is happening in the examination? Everything is happening in the examination except questioning the candidate. More or less, it is 100% pass in all the university exams. That is clinical side. The people are failing only in the theory part. So, but a teacher should do a duty without fear or favor. And don't bother about gossips. As a professional, we are not supposed to bother about gossips if your integrity is perfect. Because if I am good to everyone, it means I have done nothing. So the academic and residency training does not teach how to be a good professional or how to be a good leader. We have to add that also. So towards residents, you please command respect, have regular teaching, and allow CME. CME means we have to allow the CMEs to be organized by the students, and we have to allow the students to attend the CME. Nowadays, what is happening? Some professionals, so-called professionals, they don't allow the postgraduates to attend some symposium if it is organized by the people whom they don't like. So it should not be like that. As a professional, we should be a role model. If you are reading the newspaper correctly, even a monkey will read the newspaper correctly. So we have to be a role model for the postgraduates. Then towards residents. So we have to be strict with thesis. You may be wondering, why suddenly I am coming with Ram Kumar Venkateshwaran. See, as far as thesis is concerned, you be strict with the postgraduates like Dr. Ram Kumar. So don't behave like Dr. Meenakshi Sundaram over there. So don't be a friend, you be a guide. Nowadays, people, the doctors think if they are treating the postgraduates as a friend, they will be a good person. No, they cannot be a good professional. So you be a guide. Then the departmental hierarchy. What is happening? If the leadership is coming by seniority, as a HOD, if it is appointed by seniority alone, then most of the times the department is doomed if the HOD is not a professional person. So this is not confined to anesthesia, to any subject. So leaders must be appointed by virtue of demonstrated qualifications. So they should know what are all the problems with their staff. So their entire focus nowadays in theatre is how to run the theatre today. They are not working for a long-term goal. It has to be done. And as a doctors, we are not obeying the leadership. If you want to be a good professional, you be a good follower also. We have to obey rules and regulations. So we have to have a long-term planning, and we have to have a second leadership, because we should know a department cannot function in a vacuum. It is not creating a kitchen cabinet. You locate the second person. So try to be a leader always. Try to be a leader. If anesthesiologist is a leader coupled with the professionalism, then no surgeon will pick up a problem. Anesthesia department will improve. Infrastructure will improve irrespective of the cost if you are an administrator. So anesthesiologist, if you are a leader, if you are not a leader, if you are not a professional, you will be attacked from all the corners. But if you are a leader, everyone will obey your command. It should be coupled with the professionalism. And remember, boss is always a boss. Even if I am looking like this, boss is always a boss. If I am a director, I will be always a director. And boss can never go wrong. Because the principle is boss is always right. If you think boss is wrong, refer to rule number 1. Boss is always right. So you try to be a leader. Then surgeon, interpersonal relationship. Sometimes surgeon will love to do a sternotomy through laparotomy wound. He will be soaking the wound with adrenaline, mainly in neurosurgery, then bleeding, chatting, delaying, everything he will do. And he will change the anesthetics frequently. He will be always having a plan B. If you are a professional, if you are a good professional, then you will not be worried. If you are not a professional, then you should be worried about surgeon changing the partner, that is anesthesiologist. So what other problems he can create? He can block the direct payment, he can pay less, he can delay the payment, and selection is only by the quantum of payment. Then worse, obstetrician will be dictating the dose of oxytocin in the theater. That is a problem. Now, without wasting time, if I ask any one of the postgraduate to tell me what are all the causes of increased perioperative bleeding, what they will say? Anyone? Quick, within 1 second. What are all the causes of increased perioperative bleeding? They will say exhausted soda lime, lighter plane of anesthesia. Like that only we have taught. We have never taught the postgraduates like increase in bleeding is due to the surgeon's scalpel. It is due to surgeon's knife also. Improper surgery and cutting the vascular artery, even if it is aorta, surgeon will ask us, sir, what is the BP? It is bleeding more. So this sort of a people should be tackled with the professionalism. So how to tackle a difficult surgeon? If a surgeon yells at you, don't take it personally. First point. He might have cut a major vessel. That may be a problem, so he may shout at us. Then if a surgeon complains of a poor light, then what is happening? He may be in problem and jittery. Then if a surgeon complains of inadequate relaxation, he is frustrated and need an assistant. So we have to get a clue. This is just like anesthetists will sometimes ask the theater assistant, you bend the spine, spine will break. If he is not getting the subarachnoid block, he will yell at the theater assistant what he can do, poor person. Same way, surgeon will also give some clue. So how to handle this difficult surgeon? Talk through the staff nurse. That is always a better professional way of dealing with the difficult surgeon, because staff nurse is the feeder category for him. So you maintain a reputation. Surgeons have many choice, so also we have many choice. So relationship with the surgeon, when we were students, it was a master-servant relationship. Now it is changed a little bit, but in future I don't know, because these youngsters have to say what will be the interpersonal relationship in future with the surgeons. Obstetrician. See, the obstetrician during residency, they will be beautiful like this. But if a PPH comes, they will behave like this. So it is a problem with obstetricians. So you have to be professional. Obstetricians will yell at fixed interval. One, while entering the theater, they will shout at everyone. While delivering the baby, they will shout at everyone. If the uterus is not contracting like a cricket ball within 2 seconds, and it has to be maintained for 8 days like that, till the time of discharge without any vaginal discharge, then only they will accept you as a good anesthesiologist. Even at the 8th day, if the uterus relaxes, you will be blamed. So how to handle them? Placebo effect. If the surgeon says you give 6 ampules of oxytocin, you break 6 ampules, but you give only 2 ampules in the drip. But you have to break 6 because they will count. Then never have anyone by the side. That is a professional way, because they will have clue that the theater assistants will act as a spy for them. They say doctor has given only 2, then you will be blamed. So never have anyone by the side. And remember, even if it is a lie, it becomes a truth if it is in the good interest of the patient. So technicians, loading wrong drugs, not following the orders, leaving the theater in emergency. So never pick up a quarrel or shout at the theater assistants, especially if you are having a presbyopia and you have missed your spectacles, then they will give you the wrong drug, because they will be waiting for that. And interpersonal relationship with the staff nurse. A beautiful staff nurse may be an attraction. It may be a stress relief. But sometimes it may be a distraction or stress. As a chief anesthesiologist, I have never allowed beautiful staff nurses to be posted in the theater. Reason being, they stand by the side of the surgeon only, not by the side of the anesthesiologist. That is the biggest headache. So if you want to be a good professional, you see that also. Then we have to introspect ourselves. Anesthesiologists are greedy, no time management. They want to be a millionaire overnight. Then a slum dog can become a millionaire if the dog sits on the top of a Audi car. It is not happening in the real life. Work pressure, over dependence on assistance. Now the lifestyle as a professional, anesthesiology started enjoying definitely. I am seeing number of conference more. Conference attendance is also more, but hall attendance same. But this is an exception. Now this hall is full even for the first lecture. Probably a breakfast may be an attraction. So nowadays webinars are also happening. Then professionalism with the monitors. We have a monitor, we are living with the monitors. So now there is a professional way of selecting monitors. Now we have plenty. If I ask you to select any one dress, it is very difficult. Any one cloth, it is difficult. Same way, if I ask you to select one, it may be difficult. So we have to have a professional way. For professional way, some people are ordering with the specifications. If you give some specifications, there may be plenty available in the market like this. But you have to select only one. You may be like to select everything, but it is not possible. As a professional, you have to select only one. So at the first sight, it may be good. Going near, it may be bad. Then, how to select a professional way? Monitors are like spouses. No ideal spouse, no ideal monitor. Another one, once you own one, every other thing will look nice. That is the problem. And as a monitor, the representative will give it to you. Sir, use it for 15 days, then decide. That is not possible in the other area. So, but even if it is done, anything will be nice during the honeymoon period. So how to be a professional in selection of the monitors? If you want to select between X and Y, you know the pros of X from X and the cons of X from Y. That is a good way of doing it. And people are marketing with vigorous marketing. So we have to be very careful to be a professional. Select a monitor which can be easily handled by a staff nurse. Because if there is a staff nurse, behind her will be always a doctor. So duty doctor problem will be solved. And a new entrant, you have to have a professional thinking. If you purchase like these specialized monitors, the stress will be more, need will be less. So a good professional will avoid all unnecessary monitors. Then artificial intelligence have come in. So if you want to be a good professional, you should know what is artificial intelligence. You have to cope up with the increasing demands. So the future networking, we can even operate it from the house itself. So as a better professional, we have to be prepared for that also. Sometimes general anesthesia can be administered even from your house. So this is performing a lumbar puncture with a Google map. This is performing a spinal puncture with a robo sitting in your house. It is work from home, but the payment you have to get. Payment should not be done to a robo. Then now USG guided spinal nerve block. Yesterday you have conducted a peripheral nerve block, but USG guided central nerve blocking also will come. We have to be prepared. So my professional experience with ultrasound guided central neuraxis block. Don't think that slide is missing. My experience is nothing. So as a professional, in future, technology would improve, cell phone diversion would increase, monitor dependency would increase, clinical attention may reduce. So communication may also decrease. So a future anesthesiologist, as an anesthesiologist, as an octopus, your tentacles may be amputated. You may pertain to the theater only, or you may spread your tentacles everywhere. You can live happy. That depends upon your professionalism. 1 minute. So the motto of professionalism, this board I will keep on my table. If your job is done, allow me to do my job. So that is a good professional way of doing, because time is precious. And I want to inform all the youngsters, life is made royal by attitude and not by power. So remember, doctors and snakes are respected by public out of fear, but whenever public get a chance, both would be beaten. So professionalism is making everyone to dance according to your tunes. So the carry home message will be, when the right combination of personal characteristics, the future looks bright for anesthesia professionals. Don't think that the lecture ends. Just to divert the attention of the chairpersons, I have put the slide as carry home message. But I want to request the future anesthesiologists who are sitting as a backbenchers. See, anesthetists is Astavadani or Dasavadani like this. If you want to be a good professional, safety is in your hands. So don't be like this. Or don't be like this. See, nowadays meddling with the cell phone and chatting in the cell phone is a business, become a big problem. If you want a good professional during the perioperative period, please avoid this mobile. Don't get distracted, because distraction is always a problem. See, this I have seen in Maharashtra. Saundarya darshan evam gadi chalan dono ek saath na kare. See, sightseeing and driving should not be done simultaneously. You can do both, but at different times, not at the same time. So be a good professional. You have 2 different times for this. Always concentrate on the patient. Like this man, master the art of communication. See, the boys' hostel, instead of Wi-Fi, they have put it as free Wi-Fi available. Then there is a big queue of boys in that hostel. So be careful. And see, Malaysia welcomes 25 million visitors annually. So imagine 25 million visitors annually. That is a big problem. It's a big hoarding. So avoid communication gap. That is the art of profession. Don't fly sky high, please. Don't fly sky high. Our traffic is like this only. So you analyze the ideal characteristics and be a good professional in selection of your lifestyle. You may be like this or you may be like this. But professionalism is to be maintained. So compare the things. Our days were like bullock cart days. Now we have come to ambassador days, we were happy. But your days starts with city. City is the best car available on earth, and the owners can take a pride about owning a city car, because I own one. So concentrate on the front of the car, not on the back of anything. So you are starting with the convenient days. So don't imagine a Audi car which is greedy. So professionalism could be achieved by proper training and mental makeup. Even a orangutan can be trained. So be a good professional, train even orangutans. So the carry home message will be, being an anesthesiologist, you are born to excel and enjoy. Behave like a professional by attitude and don't bother only about infrastructure. Please help others. Youngsters, please help others. See, even the small boy helping the other boy to urinate. So we have to be a good professional helping others. Best friends will be always in touch in spite of handicaps. So now Kerala ISA has done it. They are the high-end professionals, right? So in professionalism, also in life, aim high. Then you will be a good professional. Always aim high. And I thank Team Kerala. I thank ISA Malappuram. Thank you very much.
Thank you, sir, for the excellent talk. As always, you have presented such a difficult and important topic in a much interesting way. I know there are a lot of seniors sitting here. They will have something to add or some comments, and we will allow a few questions from the delegates. Sir, please. Yes, ma'am. One mic, please.
Meenakshi Sundaram, you thought your wife is not in the audience, but Ramkumar's wife was there in the audience. So I want to give a tip and trick. I know you're telling it as a joke. Like, everyone thinks if Ram says joker, supposing that means that surgeon is a joker. You know, all my life I've heard Ram saying the surgeons are bullying us. So Ram is very polite. If he says, let's say, this surgeon, Vijay, is a joker, that means that that fellow's had it. Okay. So I want to give a tip, which Manikant, my friend, did, Ram's colleague, when we were young. One colleague, obstetrician colleague of mine, used to shout in the OT non-stop. So our OT was OR7. So Manikant, the anesthetist, had put in OR7, obstetricians should be seen but not heard. So since you give so many tips and clues, I wanted to give one for the obstetrician. So that's what you said, do it professionally. Do not fight with the obstetrician. Put it there for them to see, they know guidelines and they'll behave accordingly.
Madam, as an obstetrician, madam, just because you are here, for the benefit of youngsters, I am asking this question as a senior colleague, I can manage the obstetrician. But see, the moment the baby is delivered, you have to see the obstetrician. Of course, you are an obstetrician. They say, you place 2 ampules of cetirizine. I have 2 in the EV, 2 in the... Then
see, he's a biased husband of an obstetrician. Don't believe him. It was an I
see,
just
the
want to
thing
say it
is-
was an excellent talk. It inspired me to come here and say thank you very much. I was sitting at the back with the students. We were laughing at all your jokes,
Thank
and
you, sir.
it was very good. The obstetrician forgives you
So,
all the bad things
no,
you said.
then I have become a laughing stock, is it?
No, come on, no. Don't be touchy.
Thank you.
Any comments or questions? If not, we'll wind up the session. Thank you,
Thank you, sir.
Dr. Meenakshi Sundaram, for an excellent talk.